prestigious teacher that I was telling you about. And he has run the world-class schools program for over, I don't know, 20 years. Michael, how long has it been?
20 years.
Oh my goodness, 20 years. Okay, and it's 15 for me, but it's 20 for you. So you're even more qualified at telling everyone how this is done than me. Thank you very much for allowing us this opportunity to use your Zoom link. And Michael has been very kind and generous in getting us into a number of programs, including law ones and other science ones as well. And so today, I'm taking this opportunity to express our acknowledgments, our gratitude for his generous offerings and his dedication to education. Thank you, Michael.
You're more than. Thank you.
Okay, thank you. And now we will introduce our speakers today. Oh, before that, I want to say that we have two sites from Taiwan. I mean, the student sites. The student sites are this site, the site from affiliated high school of Zhongxin University. And in this site, we have students from 1, 2, 3, 4, I think 5, 6 schools. And later on, they will introduce their school when they are asking a question. So when you ask a question, you can say, hi, I'm from affiliated high school, Zhongxin University, and my question is blah, 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 okay? And we also have another site connecting from Taiwan, that's Dr. Tim, one of our speakers. And then also we have a site from Canada, and that is our other speaker, Dr. Rao. So right away, we will hand over the time to Dr. Rao and Dr. Huang. Over to you, Dr. Rao and Dr. Huang.
Hi, everyone. Good evening. And good morning to the Dr. Rao. She's in Canada, so it's we are 12 hours ahead as opposed to Canada. And I think I will be the first one to talk about a little bit about the dentistry. And actually, it's really my pleasure to be here to meet all of you. Several weeks ago, as soon as Hank told me about this meeting, I said, yes, I can help because I'm really interested in it. And the first person came across my head is Dr. Rao. And she was my colleague when I was practicing in Canada. And she's really brilliant in dentistry, and she's intelligent. Yeah. So after I finish my talk, and she will continue, and I really appreciate her help from Canada. And
thanks, Tim. Thanks to you.
Okay. And as I just mentioned, and I'm practicing both in Canada and Taiwan. In Canada, I'm practicing in Toronto. And in Taiwan, I'm practicing in Yunlin County. So right now, because the pandemic, as you know, the COVID-19, I couldn't go back to Canada because there's a lot of restriction over there. And it's very difficult to practice in dentistry in Canada. Too many confirmed cases there, and the government already shut down all the business. So I decided to stay in Taiwan to continue my practicing. So right now I'm practicing in Yunlin for this period of time. And I have been practicing dentistry for more than 30 years. So I graduated in 1989 from the Kaohsiung Medical University. And in 1995 to 1997, I went to the Boston, the Tufts University to do my postgraduate program, which focusing on orofacial pain. It's a little bit different from the dentistry, but it's involving the pain around about the neck, the head, and also the teeth as well. So it's a very interesting program, and I finished there. I just as I mentioned, I graduated in 1989, and usually when we finish the university, the school will give us the diploma, and the diploma will show you the degree, right? So usually in university, the degree is the bachelor degree, and in the dentistry, is a little bit different. So that the degree will show you is a doctor of dental surgery. So it's different from the regular degree we receive from the university, which is bachelor. In dentistry, we receive the degree as doctor of dental surgery. So which means the dentistry is like a surgeon. The dentist is like a surgeon. It's not just like a physician. The physician, when you go to the clinic, talk to the physician, and they just listen to your signs, listen to your symptoms, and they will do the diagnosis and give you the prescription and finish. But in dentistry, you always need to use your hands to finish the work, just like a surgeon. So that's why the degree shown on the diploma is dental surgery. So I remember I gave you a list, a sheet of paper, and it covers most of the dental service we providing in dentistry. And I hope you already read about a little bit about it, because there's some special terms for you to understand. And for this moment, I think I will cover a little bit about the dental service for you. So for example, if you have the handout with you, you can look at the handouts. I think when you go to the dental office, most of the time, you will do the cleaning, right? You do the cleaning, and maybe you have the decay and you need some fillings. So I think most of the people have this kind of experience. So we do the fillings, we do the cleaning for the gum. And also, if you have a missing tooth and you need to replace it, we can use the bridge to replace the missing tooth. Or in the modern dentistry, we use the implant. The implant is put the artificial roots inside your bone and make a artificial tooth on top of it. So this is a new technology for the modern dentistry. And also, you because you are the teenager, right? So I think in the classmate, your classmate, some classmates, they have the braces on their teeth to straighten your teeth, because some people, they don't have a very nice teeth, and the teeth is crowded or the teeth is flat out. You put the metal brackets on top of the teeth to make the teeth straight. So some people, they will do the braces on the teeth. And also the dentist can provide like a oral cancer examination. That's very important. When you go to the dental office, you are not just doing the fillings, you are not just doing the cleaning. When the dentist look at your mouth, we will focusing on exam the whole oral soft tissue. For example, like some people, they have some discoloration of the soft tissue, like red or white on the soft tissue. Then we will we will take a deep look, because which means there's something wrong inside the soft tissue, and it may be the cancer. So when you go to the dental office, the dentist not just look at your teeth, they also look at your soft tissue to do some screening of the oral cancer. And also, let me think, and the crown surgery, let's come. Okay, so and also you have the root canal treatment. I don't know you the root canal treatment is like just when you have the pain on the tooth. Sometimes the doctor, the dentist will take the nerve out of the tooth to relieve the pain. That's the root canal treatment. So I think I just make a very simple introduction for you to understand the dental service we are providing. And in the modern dentistry, and we using the computer to help us. So it's like a digital dentistry. You can remember this word, digital dentistry. You can Google it, and you will understand more. The digital dentistry, including we use the 3D printer to help us to build the false teeth, and sometimes we using the machine like a CEREC 3D. You can Google it, CEREC, like CEREC, CEREC 3D. And we use that type of machine to help us to do the crown or the bridge. So you can look at the Google, and you can find out more information about that, because this is a modern dentistry, especially if you are interested in going to the dental field. You will touch this in the future. So just I mentioned, I practicing in Canada and in Taiwan, and so I have the license for Taiwan and Canada. As a dentist, I can practice in Taiwan, but if you don't get the license from Canada, you cannot practice there. For the IT program, like IT business, you can go everywhere to do the work, right? But for the medical field, you need a license. Each country has their own board exam. If you pass the board exam, then you can get a license, and you are entitled to practice there. So it's not just like you have the license in Taiwan, then you are qualified to do the dentistry in other countries. Each country has their own dental board exam system. If you pass that, then you get the license, then you can practice. That's how we work in the dentistry. So I think I'm not going to talk too much. And right now I give back to Madam May. Get back to you.
So, Dr. Rao, over to you.
Hi there. Hope everyone's doing well. I guess it's late in the evening for you all. So good evening to you all. And it's 9:18 right here right now. Thanks everyone for providing me this opportunity. Thanks Tim, Dr. Huang for asking me to do this, and also Miss May for reaching out. It's a pleasure talking to y'all. I know y'all are very interested, and I heard that that some of you may choose to go into dentistry. So we'll give you a little. Dr. Huang has already talked about how he got his licenses. So he practices in Taiwan and Canada. He went through a very rigorous process, but kudos to him. Great job. It's not easy, but it's worth it. Okay, so I have a little presentation. Unfortunately, I don't know how to link it to the meeting, but I'll try to make a small slideshow right here.
So Dr. Rao, are you trying to share your slides or photos?
Yes, I have some slides here, but I don't know how to. I cannot see a link to share the slideshow.
Okay, so it should be, let me see, where is it? It should be the button at the bottom of the screen, and it's green. Is that green? Yeah, and you have to push it. And Mr. Cunningham, are you here with us still? Because of the COVID-19 situation, the Zoom company has been bombed with a lot of unnecessary attacks. And so they need okay, thank you. So they need the host to allow you to share. In the past, you didn't have to, get access. Okay, good. Thank you, Michael. Thank you, Mr. Cunningham. Yeah, we see your slide now. Good.
Okay, is that good?
Yeah, okay. It says the profession of dentistry.
Yes, the first slide. Y'all can see it? Perfect. Okay, can I go ahead?
Sure.
Okay, so here's a little about me. I was born and brought up in Mangalore, in India. I left India in 2010. That's when I got married, and we moved to Singapore. I was in Singapore for about 3 years, and then my husband, who was working with a Canadian company there, had to move back to Canada. That's how I ended up coming back to Canada. Now, a little about my journey through dentistry. I got my Bachelor of Dental Surgery degree in India from A.B. Shetty Memorial Institute of Dental Sciences, and I practiced in India for 8 years. I had my own clinical practice, and I also lectured at the same school that I studied in for 7 years. So I was a teacher there too. Well, I left teaching in 2010, and I do miss teaching. So I take this opportunity. It's not really teaching you something, but it's interacting with students, which is what I used to love to do. I plan to go back into teaching someday, but not right away. Right now, concentrating on clinical practice. Now, my second degree for getting a license to practice, and I didn't go through the same system that Tim went through, Dr. Huang went through. I went through a different system. I got into school in the US for a Doctor of Dental Surgery, a DDS program. It was a 2.5-year program, and that was specifically for international dentists, people who already are dentists and are practicing, have been practicing in their own home country. But when we moved to the US, in the US, we have to go through schooling. So we do a 2 or a 2.5-year program. I'll talk a little about it later on. And I hold licenses to practice in the US and in Canada, specifically in Ontario. Canada has different provinces, so each province has their own licensing body, and I am licensed, like Dr. Huang, licensed to practice in the province of Ontario. Currently practicing in Toronto. Like I said, I was a lecturer and I practice. In Canada, I've been an associate dentist since 2016. Now, an associate is we are independent contractors, but we work for someone else. We work at the clinic is owned by someone else, another dentist, and we work as an associate in that clinic for another dentist. You can also own your own practice, and I am in the process of buying a practice right now. We're still signing, going through papers, and there's a little due diligence that's going on. So hopefully in 2 months, I'll be able to own that practice. I'll go through a little about how you get your license in the US and in Canada. So in the US, the regular students go through a 4-year program. It's a 4-year degree program, and it's a 2 or 2.5-year program. Different schools have different courses, so some schools may have a 2-year program, some schools have a 2.5-year program. And this is specifically for international dentists. We study along the regular students, but our course is cut down to 2 or 2.5 years. Once we finish this course in the US, we do the licensing exams and we get our licenses to practice in whatever state where we want to. In Canada, it's a 4-year regular program, and you can either go through an equivalency process. That's a set of exams where there's theory exams and clinical exams. Now, Dr. Huang went through this equivalency process and then gave his licensing exam and got his license to practice in Canada. Canada also has a 2-year program for international dentists. Now, you have to be a permanent resident or a citizen to get enrolled in these programs. It's a competitive program, but it's worth it. So once you finish the equivalency process or the 2-year program for international dentists, you can write your licensing exams and you get your license to practice. Again, each province has their own licensing body, and then you go apply. You have to submit papers, documents, and that's how you get your license. That's how you get your license, and then you start practicing. Now, in the US and in Canada, there's something called pre-dental courses. Back in India, I finished my 12th standard, and in my case, I went through the Bachelor of Science program, but a lot of my classmates came directly after the 12th standard. That's how India works. Now, I'm not very sure how Taiwan, I don't think there is a pre-dental course in Taiwan. I think it's the same. Dr. Huang, could you just enlighten us a bit there?
Yeah, I will talk about that a little bit, but it's different system from the USA and Canada.
Okay. So in US and Canada, there's something called pre-dental courses. You take science subjects and you have to collect credits. There's a certain number of credits that you need to get into dental school in the US or Canada. Now, there are, like I mentioned earlier, the licensing bodies, there's different licensing bodies in the different states. US has states, Canada has provinces. So each state or province has their own licensing body, and then you have to follow the different regulations that are put out by these licensing bodies. Now in Canada, I'll get back to how dentistry works in Canada. In Canada, dental clinics can be corporate or privately owned. Now, corporate means that there's a big company that owns dental clinics, and privately owned is where an individual owns a dental clinic. The team, a dental team, consists of dentists, dental surgeons. It consists of dental hygienists. Now, what do the hygienists do? They clean teeth. They take care of the gum. If there are gum problems, they take care of it. Now, there are specialists who take care of gum problems too, but the specialists, what we call periodontists, they take care of severe gum issues, when the gum issues cannot be handled by the dental hygienist. Here the protocol is to visit the dental hygienist once every 3 months, or once every 4 months, or once every 6 months, depending on the oral hygiene in each individual patient. Now, the other team members are dental assistants. They help when the dental surgeon is working on a patient. The dental assistants sit on the side. They have a chair by the side, and they help the dentist do the various procedures. Like they hand instruments, they hold the suction to take out. When the dentist is drilling teeth, there's a lot of water that comes out of the little machine. So the dental assistant helps to suction all the water out. And they have a lot more responsibilities too. Then there are dental specialists. Like I said, there is someone who deals with the gum. A specialist who deals with gum disease is called a periodontist. The specialist who deals with the crooked teeth, someone who straightens teeth and puts braces on, is called an orthodontist. Someone who there are specialists who replace teeth. If there is a missing tooth, and a regular dentist can do these procedures too, but then their dental specialists are specialized in certain procedures. Now, if there's a missing tooth, and replacing that tooth with, let's say, a denture. Denture is something, it's a plate that has artificial teeth on top of it that the patient can wear, and that replaces this plate, and plate with teeth replaces whatever teeth are missing from the patient's mouth. And there are a bunch of other dental specialists. Then there's the lab technician. There's a patient coordinator. Patient coordinator is the one who sits outside, greets the patient when the patient comes into the clinic, makes an appointment for them, picks up calls, schedules appointments for the patients, and also when the patient's leaving, they make sure that the patient's next appointment is scheduled. So they sit at the front desk. So the procedures that a dental team does. There's hygiene, like I said, the hygienist does the cleaning of teeth. There are restorations, what we call restorations, and in simple words, they're called fillings. When there's a hole or a cavity in the tooth, when there's decay, all the decay is taken out and a filling is put in there. The filling replaces the missing tooth structure. Then there are extractions where we may not be able to save a tooth. So imagine there's a big cavity, or there's a big crack in the tooth, and the tooth needs to go. So we remove teeth, and the process is called extraction. Crowns. Again, if there's a big cavity, there's decay in the tooth, and there's very little remaining tooth structure, and it's weak. So if you bite on something too hard, that tooth may crack or break. So to prevent that from happening, we put something called a crown. It's like a cap on top of a tooth to protect it from breaking down. There's root canal treatment. If the cavity is too deep into the tooth and it reaches the nerves and the bloods, where the nerve and the blood supply is, the tooth needs something called a root canal treatment. Then there's dentures, again, talked about it. Dental clinics are always it's a sterile environment. We follow disinfection procedures, we follow sterilization procedures. And there's a whole lot of disinfection and sterilization protocols that we have to follow. And that's what's important during these COVID times. We have to follow proper disinfection and sterilization procedures. There is a code of conduct for privacy of patient information here. We cannot let out patient information. We cannot give out patient information to anybody outside. The patient information is private, and it stays within the clinic, and it doesn't go out of the clinic. Now, once the patient comes, there's here the protocol is planned treatment. We have to plan a treatment for the patient and get the patient's consent to go ahead. We have to get them to sign a consent form, and only then can we go ahead with certain procedures. So this is the clinic that I'm looking to buy. Here are a few pictures. We have the dental chairs. Now there's different operatories or rooms where we practice dentistry, where we practice the procedures. There are hygiene rooms. The one with the blue chair is specifically a hygiene room. It doesn't have too many instruments there because it's just used for cleaning. Now the picture with the red, I hope you all can see this slide clearly. The room with the red chair has all the other things that we need to do the fillings, to do RCT, to do extractions, to do digital scanning. If you can see at the corner of that picture, there's like a little green tube, and that's a nitrous oxide apparatus, where if patients are very anxious or apprehensive, then we use that to give them nitrous oxide, which is also called laughing gas, so that they can relax and get their treatment done. There are, you can see there's Dr. Cesar, that's the last picture there. It's a milling machine where teeth are milled inside that machine. We scan them in the patient's mouth and send it to this machine, and the machine makes the tooth. Initially, a human being used to sit and make a crown. It was they used to make it with their hands. The lab technician would sit and make a crown. But now we just send information to this machine, and the machine makes the crown inside. So this is typically how a dental chair looks like. There's the chair with the light and the X-ray machine, and there's the dentist chair and the assistant's stool. This is a small picture showing how dental work is done. Here is another machine. It's called the scanner. It scans teeth, scans teeth for various purposes, maybe to make a denture, maybe to make a crown. This is how we dress up to see a patient. Initially, it used to be like this. We used to just wear a mask, eye cover, gloves, scrubs. But right now with COVID, the protocol has changed a little. We have to cover ourselves in order to protect ourselves and in order to protect our patients and the people who work for us. So that's a little about how dentistry works. I know I haven't covered, maybe I haven't covered everything up, but if you all have any questions, please feel free to email me I'll send an email link to Miss May, and then she can share it with you all. If you have any questions regarding dentistry, or if you have any questions regarding how to get into dentistry, about your getting into the career of dentistry, please feel free to email me or Dr. Huang. I'm offering Dr. Huang's email address too without asking him, but I'm sure he'll be willing to help you in any way he can. Now, good luck to all of you. Choose your profession well. Choose one that'll make you happy, okay? And not something. Do your research. Check. Go maybe observe some dentists in a clinic and see if that's the right profession for you, and go ahead with it. And always believe in yourself. That's the most important thing. Okay. Good luck to everyone, and thanks for this opportunity. Back to you, Miss May.
Much. And students have tons of questions for you.
Okay. Sorry, I took a little too long.
Actually, they were very thrilled. They're very thrilled in hearing both your talks. And Dr. Rao, could you stop sharing the slides right now so that we can get a view of everybody?
Yes. Yeah.
Thank
Yeah.
So is it okay to open up to questions right now, both doctors?
Yes. Go ahead.
All right, so questions. If you have a question, please raise your hand. Okay, we have one from Hank over here. He will start the first one. Go ahead.
Hello, I'm Hank from Dentistry High School. My question is, there was one time I read a newspaper which is regarding a patient disease result from tooth extraction, and this accident totally caused a medical dispute. How do you think about this kind of accident?
Was that clear? I think he's talking about a patient that came into a dispute with a dentist or a doctor, and could you tell us more about the dispute?
The dispute is caused from tooth extraction.
Tooth extraction?
Yes.
What actually happened?
The tooth extraction, the patient disease because the tooth extraction.
Oh, the patient died?
Yes.
Oh my goodness. So a patient died from getting tooth extraction, which sounds very rare. And then so there was a lawsuit, I'm sure. And you want the doctor's thoughts on this?
I want to know how you think about this kind of accident.
Okay. So your thoughts and yeah, what you think about, you know, this kind of dispute and problem.
So this is it's a very rare occurrence. Yeah, there have been instances where the patient may have died on the chair. Now, is that because the tooth was extracted, or is that because the patient had a pre-existing condition? We don't know. Now, we don't know all the facts about this case, so it's a little difficult to explain exactly what might have happened. I didn't really get what Hank wants to know about this, but before we do any procedure, we do a thorough medical history examination. We ask the patients about their medical history. We ask patients about their dental history. There's a questionnaire that the patient has to fill. So if the patient has extreme medical conditions, let's say uncontrolled blood pressure, very high blood pressure, we don't do a procedure. We send them to an emergency room or to a hospital to get themselves checked, because obviously a patient who has very high blood pressure cannot be sitting on the dental chair and getting an extraction done. There are certain reactions to the medications that we may give them, allergic reactions. Now, all these reactions and procedures are well controlled. Now, this may be a very rare instance. It doesn't happen every day, and it doesn't happen every minute. So it's like, let's say, 1 in a million chance of this happening. So don't worry about. Yes, there could be lawsuits if the dentist has done something wrong. Of course, the dentist will lose license, and maybe there will be some other punishment. But before we do any procedure, we take a thorough history. We do a lot of questioning. We question their medical history. We question their conditions. We check allergies. So it's a rare occurrence.
Thank you.
Dr. Huang, would you like to add something?
Yes, yeah, just like you say, in the dental chair, we always ask the patient about the medical history, and especially if I'm going to do the extraction, I always check the blood pressure. So if it's too high, then I will send them back to the physician to do the treatment before we do the extraction. So it's very important for a dentist to every time we have to check their medical history. And usually the extraction won't cause the death. Most of the time, it's because the undermined medical health. The patient has some medical problem. For example, a long time ago, when I was still young, because I'm in dentistry for 30 years, but almost 30 years ago, I heard about a case. It's not my case, but a person died after the extraction, but after his death, they did the biopsy and they found out he has leukemia. So he never knew he has the leukemia. So the extraction is not the reason causing the death. It's because the leukemia. So most of the time, the extraction won't cause the problem. It's from the undermined medical health. So if you just mentioned the extraction caused the death, this is it's a very simple question. It's too much simple. It doesn't give you too much information for you to do the judgment. So just like, yeah.
Sorry.
It's okay. I'm done.
Okay, so I want to do a quick recap in Chinese so that I want to make sure that everyone understood. The question was in Chinese， 就是问说，刚刚那个同学问说，曾经有人拔牙都死掉这样，那到底是那医师的想法？那医师的最重要的点就是，首先呢，他到底是不是真的死于拔牙，他是不是其他因素造成的？有可能是其他的那个情境跟因素造成，那所以你在做任何手续之前都要先问清楚他的 medical history， 就是他的那个的一些过往的病史这样子。那么曾经有一个例子，就是他死掉之后，人家去查验原因，那其实人家是那个人是死于白血病，那他都不知道他有白血病，他就刚好又去做治疗，然后就死掉，那你以为他又死于他这个治疗，其实他并不是。所以其他的那种高危险的因素，还有什么高血压，还有过敏，有没有？你高血压你就不应该在那里接受那种比较高风险的疗程，这样。Okay, got it? Okay, so I think we have more questions, tons of questions flowing in. We have another question here from a teacher. We have an English teacher here with us, another English teacher, my colleague, and then we'll go to Nantou High School. Okay, I know there are a lot of questions coming from Nantou High School too.
Hi, Dr. Huang and Dr. Rao. Okay, based on you said you take about 4 years for your dentistry degree, right? But as an international student, you have to take more, probably 2 or 2.5 years for the international dentist, right? Is that correct? Based on your
Yes.
Okay.
In the US and in Canada, yes. Regular students do a 4-year program. The international dentists do a short program. It's a 2.5 year program because we get integrated into the 3rd year. So we do the 3rd year and 4th year.
If the students are from the United States or Canada, they don't have to take 2 or 2.5 years for the programs, right? They just need to take 4 years.
For the regular students,
Okay,
yes.
for the regular
It's a 4-year plus a 3-year program because in the US you cannot get into dentistry after the 12th standard. You have to go through pre-dental courses. You have to do your bachelor's. You have to get a bachelor's degree, and then you get your DDS or the 4-year. After the 4-year program, you get a DDS or a doctor of dental surgery degree. Yes.
Yeah, because as I know in Taiwan, usually it would take about 6 years for the students to graduate from that.
Oh, okay.
Dentistry. Yeah, that's right. This is a probably Dr. Wang, he used about this. So Dr. Wang, so when you practice your dentistry in other country, you still have to take 2 years for the job, or you can just get into the career.
I missed the last part.
Sorry. Okay, you finish your dentistry study program in Taiwan, right? So when
Yep.
you want to practice your dentistry in Canada, so you need to take a few years, then you can pass the test, and then you can practice dentistry over there.
Okay. You know, it's a different system in Canada.
Yeah.
Yeah, the Canada, just like Dr. Rao showed in the slides. The 4 years of program is for the people graduate from the high school. So after they finish the high school, they have to go to the 4 years of regular university to get the bachelor degree, then go to the 4 years, another 4 years of dentistry. And for me, because I'm a foreign trained dentist, so I can go through the equivalency process. So I can take the equivalency test. After I pass the test, then I can go for the board exam. That's the route I took
Okay.
for my licensing.
In another pre-dental course that is open to all the undergraduates or just some special departments?
So there is a long list of courses that you can take. Now, I personally didn't go through that program, but there are most of them are science subjects, especially biology. So you have to do these courses, and there are credits. There's a certain number of credits that you need to have to get into schooling. If you need more information, I can get it for you from one of the regular students, because I didn't go through the regular schooling process. I don't want to give you wrong information, but like I said, there's a long list of courses, subjects. There's a long list of subjects that you can take, and it's up to you. You want to take biology? I think biology is compulsory, but there are other subjects like psychology. There could be a subject in arts. There could be mathematics. So they just require a certain number of compulsory subjects, and there's a certain number of elective subjects. But there you have to have the right amount of credits or points to apply to dental school.
Okay. And I know there's so many different titles for different dentists. For example, gerontologists or some gum disease specialists. So
Yes.
they need different degrees for that, or any kinds of special training they can do the job.
Yes. So once someone finishes the 4-year program or the 2.5-year program, they can apply to become specialists. And the specialty course, what we call the masters, let's say masters in periodontics for a gum specialist, master in orthodontics for a braces specialist. Now that could be a 2-year program or a 3-year program, depending on the subject. And the specialization in oral and maxillofacial surgery, where the specialist does major surgeries on the face and in the mouth. Like if there's an accident and someone's bones in the face is broken, then you need a oral and maxillofacial surgeon to repair those. So that's an oral and maxillofacial surgery course. That's a 4-year course. That's 4-year course. And if there is a super specialization in oral and maxillofacial surgery, and that's a 6-year course. And those courses are after you finish the basic dentistry course.
Okay. Thanks for your explanation. I think the students get quite a lot of difference from your words. Thank you.
Thank you. And because of time constraint, we need to move on to more questions. And each school has a quota of 1 question to raise. So we will take two questions from Nantou High School because they have a number of students there. So Nantou High School, right away, can you ask your questions? They have a student to the front and ask the questions.
Dr. Rowe and Dr. Huang, I have worn crowns and caps for 2 years, and I just removed it a few months ago. And I heard that American wear crowns and caps under 10 years old. And in Taiwan, the people usually wear it from the age of 15. Dr. Rowe and Dr. Huang, I would like to know the difference between these 2 points of time and which one is better.
Sorry. Could you repeat the question, please?
Okay. Dr. Rowe and Dr. Huang, I have worn crowns and caps for 2 years, and I just removed it a few months ago. And
So
I heard that Americans wears the crowns and caps under 10 years old. And in Taiwan, the people usually wear it from the age of 15. And I would like to know the difference between 2 points of times and which one is better.
So you mean to say you had a cap, you had a crown on the top of your tooth, right?
Yes.
Sorry. I think that she has braces. She misspelled. Yeah.
So you had,
I don't
was
think
there
that you have the crown.
wires?
Can we circle back to that question later on? And please have your teacher type the question to me first in Chinese and in English, so that we can actually try to figure out what it is you're trying to ask. And please stick to the questions that we have corrected, so that we can actually understand what it is you're trying to ask right away, because we have very, very, very few minutes left. So we will have we'll turn back the chance to the students here. Do you have questions? Any questions right now? Otherwise, we're gonna, go. No. 玉琴 Rita. Go.
Dr. Roy and Dr. Wong, I have a question, a general question to you. And I have heard that some people said that the job of the dentist is not as tough as the jobs of other doctors, and that other doctors are more money. What is your thoughts on this?
Miss May, could you repeat the question? It was a little soft.
Oh, okay. Is it okay? Some people said that the job of the dentist is not as tough as the job of the doctors.
Okay, got it. Yeah. As a dentist, I would say that my job is it's tough. It's not. I mean, it is a little stressful. Now, comparing to doctors, is mine less stressful or less tedious than the doctors? I don't know. I have not been a doctor. Well, we always like to say that our work is tough than the others, right? But I think it's, if you enjoy what you do, I think it's everything's easy.
Thank you. Do you have another question here? Press the, okay, other schools? Any representative from other schools? Taichung, Yuzhong? No? Okay, we'll go back to Nantou High School. Can you have another student ask another question? And if you can, have your teacher type the question to me on instant messaging line, so that I can relay the question. Nantou High School, do you have another question to ask? Nantou 高中, 赶快 unmute.
Yes. Hi, doctor. According to Canada's medical, you think what needs to improve?
What needs to improve? Okay, Canada has a free healthcare system, and they're doing a good job. They're doing a great job already. It's free. The patients go to the hospitals. Well, dentistry is not included. I'm talking about medical practice. You have a problem, you have a medical problem, you go to a hospital, you get free treatment. Now, is there something that they can improve? Yes, they can bring more doctors in, because there's a short supply of doctors here, especially in what we call the outer areas, uh, what we would call rural areas, right? There are shortages, so maybe they could bring in, have more doctors graduate, bring in more doctors from outside, and that's one way they could improve their system. But otherwise, it's a great system here. Yeah.
Thank you very much. We have a question here from the first senior high school, Taiwan.
Okay, I'm asking about that. And fluorides are added into toothpaste, but rate of caries is still high. How do you think about the causes?
Did you get the question?
The caries rate is high. We see it a lot. Now, I think I would blame it mostly on diet. There's a lot of dietary changes that have happened. We're more inclined to eat fast food, processed foods, carbohydrate. There's the high carbohydrate diet, high sugar content. I've seen a lot of patients who drink Coke every day, Coca-Cola. They drink Coca-Cola every day, and not just one Coca-Cola, they drink 2-3 Coca-Colas every day. That's a lot of sugar in the mouth. Now, the bacteria that cause decay or caries or a cavity, they love sugar. So in the mouth, there's sugar, there's bacteria. Bacteria are always there in your mouth. There's good bacteria, there's bad bacteria. Now, if the bad bacteria finds sugar in your mouth, they're going to be happy. They're going to be dancing and then eating away the sugar and eating away your tooth. That's how a cavity forms. So I think it's mainly due to dietary reasons, and also oral hygiene measures. A person has to brush twice a day. A person has to rinse or gargle their mouth every time they eat or drink something. Flossing. Again, flossing is important because it takes away plaque, what we call plaque, from between teeth. So if all oral hygiene measures are followed, I'm sure the caries rate will get under control. Dr. Huang, you have something to add?
No, it's good.
Okay, perfect.
Thank you so much. Because of a time constraint, we won't want to have the two doctors lingering on too long. And I think everyone feels so honored to have very, very nice dental surgeons and willing to share so much with us today. And as they have mentioned at the very beginning, we have a lot of questions from the students, but we can email them to them. We
Sure.
can email the questions to the doctors, and they're willing to answer your questions. Is that correct?
Yes.
Yes, thank you so much, because they have tons of questions. They have written them down, and they are really eager to know the answers. So further on, I will be sending the questions to you. And thank you so much for your time. This has been a very successful session. We have had 5 links we linked together. And thank you so much again to Mr. Cunningham for this grand event. And I hope we have more of these sessions in the future again, right, everybody? You're supposed to make sounds like yay, when clap your hands. Yeah. It's too quiet to show eagerness, right? Okay. So thank you so much. I know in the midst of the pandemic situation, everyone around the world is trying to stay safe and stay, try to keep up with work as much as possible. And we hope that the situation gets better in Canada, where, especially where Dr. Rao is, and we can get back to normal pretty soon.
Yeah, get back to normal life. Yes, we're all waiting for that.
And thank you again, Dr. Rao and Dr. Huang, for today's great talk and interaction with the students. And also Mr. Cunningham again for the link. And thank you again so much. And Nantou High School will stay connected. I still need to get on a few things over to you. And thank you, doctors. Thank you. Bye-bye.
Thank you. Take care, everyone. Take care. Bye now. Thank you.
Bye.
南投高中还在吗？
在。 在啊，老师。
哎，南投高中，你们很多很棒的问题，为什么没有问？怎么问？刚刚问的那个问题都没有事先写，所以就会很不清楚，大家都听不清楚在问什么。所以应该问你们之前老师有改过的，那个我改那么久，结果你们都没有问，那么问题好棒哦！我跟我们新部同学说，你们问题怎么可以提那么棒？那一天他们想出来真的很棒哦啊，结果都没有一题都没有出来。对，所以那个尤其是你第一次提问，或是你根本很没有常态在做那个视讯的，或者是长期跟学术的研讨会有这样的经验的话，尽量就是问题就是让老师修过，才不会confirm 你的问题是什么，到底就是 what is it that you are actually trying to ask 啊？有些时候是你用错关键字，我们就以为是另外意思，或者是完全听不懂所以尽量就是这么多这么棒的 question， 那你现在可以还有一个补救方法可以寄给我这样子。打好就是打电子档，然后寄给我，就给那2位医师，他们很愿意，他们非常热心，真的是太棒了，他们愿意再看 email， 因为我觉得很多讲者不会事后还要想要看我们的 email， 然后他们愿意看又愿意回真的是很感谢他们。所以那个之前的问题先就是我帮你改好，全部正确，请把它打成电子档，然后那个老师收集全部一起寄给我，那我们就一批就寄给他们这样子。OK， 好，不然就有点可惜，因为刚刚同学不然音也听得到，可是就不太清楚他要问什么，因为他们一开始，他们后来也觉得是不是要问戴牙套，好像也不是，对不对？是还是不是？
戴牙套。
哇啊！可是他问的都不是戴牙套，你刚刚问的英文我也没有听到，戴牙套是 wear braces。Right，OK， 而且戴牙套好像曾经有一个同学我有改到一个问题，有问到。有人有问到，我有帮他改到 wear braces， 所以刚刚没有那个一些那种关键字没有出来，所以后来那个我们台湾的那个黄医师有猜到，可是就是已经很后面，然后这样子就再问下去，就整个后面的同学 question 都没有办法出来，会有点可惜。所以尽量 stick to the questions that you have already constructed and it has been corrected, and then it will be more efficient to carry on the session. Okay, yeah. So thank you very much, Ms. Luo, and all the students. Here and over there and everywhere, and for your time today in learning. You have done a good job in contributing your time, and the teachers have done an even better job contributing their effort and their time. So a big round of applause to all the coordinating teachers. 你的老师要非常辛苦，那我们还要这个感谢那个 Hank 这边要给他鼓掌一下。那个 Hank 是他这一次就是 student coordinator， 然后他去协调那个，因为那个医师他那个台湾医师他认识，所以他就有帮忙做很多那个协调，才促成今天的那个讲座。我们给 Hank 掌声鼓励。对所以那个很难得。然后他在南投那边也帮他们辅导他们怎么去做视讯的那个一个课程，然后还提供自己的设备，吓死我了这个学生还要自己提供设备，我第一次听到的好，那南投老师那个罗老师还有没有什么要跟我们那个同学分享，或者是那个提建议的？很快速。
谢谢老师，我们学生都做很多笔记，学到非常的多，下次会考虑。
好 ，OK， 那个我有拍到2张投影片，我会上传到云端，然后那个投影片不要拿去张贴，你可以笔记可能没有做到的，因为它有几张字比较多，我怕大家没有抄到的，所以我会把它拍到，是有点歪歪的，但是你还看得清楚里面的字。但是所有同学听到那个不要再转传那个是我没有经过他的同意就先偷拍了，所以我是要给你做笔记用，所以你不要把它转贴都不要那个。我应该 po 2张，然后你们就拿来就抄到你的笔记，因为有时候很快速，你可能没有抄到这样子我就把它拍上去 ，OK， 这样 OK 吗 ？OK， 好，那个我们今天因为很晚，所以我们连线就到这里那感谢大家的参与，谢谢，拜拜，
拜拜，谢谢。